Threats to fluid balance. So our body's job is basically to maintain homeostasis, right? That equilibrium, that total, everything is equal, consistent, all right? And this includes for fluid and electrolytes. Our body's job is to maintain fluid and electrolytes in a balance, okay? This is going to be chapter 16 in your Lewis 10th edition and chapter 22 in Wong. So we're going to talk about all these different organs and how they help maintain homeostasis. This is all review. This is all stuff you guys know. The kidneys, they maintain fluid and electrolytes because they filter things out and they excrete, right? They help with electrolytes. They help with pH because they excrete the excess. They help with metabolic waste. Your lungs, you actually lose fluid through your lungs because when we breathe, when we're breathing out, we're actually losing respiratory droplets. Okay. So we lose about 300 mLs per day just by breathing. Just fluid needs 300 mLs per day. So that's why when you talk more, like the days that I lecture, I'm like dying of thirst because I've lectured more. I'm apparently spitting on all of you in the front row. You're welcome. But I'm losing extra fluid because I'm talking more. But just so you can imagine that, what happens if your respiratory rate increases? What happens to your fluid needs?
Demands are higher.
Their demands are higher, right? And we forget about those kind of things. So if your patient has an increased respiratory rate because they have some kind of respiratory illness, they're going to need extra fluids because they're losing more. Heart, actually, yeah, of course, the heart is responsible for cardiac output. And the heart kind of, when we have good cardiac output, our organs are working properly. So our kidneys work well when they're properly perfused, and they get perfused when we have good cardiac output. So although the heart doesn't directly maintain fluid balance, when our fluid balance is altered, it alters our cardiac output, all right? And when our cardiac output is altered, then we don't have organs that function correctly. So our kidneys won't function because they're not getting the perfusion they need. Adrenal glands, that is that whole aldosterone RAS system that you guys, do you remember that? Kind of sounding familiar? Mm-hmm. All right, so it helps with sodium retention. And when we retain sodium, what follows sodium? Water, okay? So when we retain sodium, we retain water. It also helps with potassium excretion. So if you have a child or an adult with some kind of adrenal tumor, they could increase their sodium retention, causing their water needs to be increased, or which can also then increase their potassium excretion. Or they could have the opposite way where they're losing sodium, and so they're losing water, and their fluid needs might be increased. Parathyroid regulates calcium and phosphorus. Pituitary also secretes ADH. So all of these organs have a role in helping maintaining homeostasis for fluid and electrolytes. And you have to understand that because when you're treating a patient, they're going to say, your child has a respiratory rate of like 40, and on physical exam, you note dry mucous membranes. They're not going to tell you your patient's dehydrated because they're breathing too fast. They're going to give you, an organ that's not functioning, give you some clinical manifestations, and you got to know, because of all that, I know I need to increase my fluids, right? That's the biggest thing you're going to see in level 3, and I'm not sure if I already addressed this, is that it's no longer just knowing that the kidneys excrete, or that when we breathe, we lose respiratory. It's how to apply it, okay? It's no longer, I know A and you're asking me B, and I just follow that. We're going to give you B, you got to figure out A, and figure out C in the meantime to answer. So, things that threaten fluid balance. There are physiological things that threaten our fluid balances. So, obviously, organ function. So, if the kidneys are, like we just talked about, if the kidneys are malfunctioned, or the lungs, our respiratory rate is high because we have a respiratory infection, it's going to threaten our fluid balance. Any kind of inflammatory or infectious process. If they have diarrhea, they're going to lose a lot of fluids, right? If they're vomiting, they lose a lot of fluids. Most of the time when people have like a bad stomach virus, you feel horrible, right? You feel like death. You feel like death not because of the virus, but because of the dehydration. You can give someone a bolus of fluids and they're like, boom.
We've seen a lot of instances between work and out in the real world where people are feeling funky. I asked them, have you drank any water today?
Yeah.
So many issues can be fixed with just a little bit of hydration.
They do. It really, a lot of times we have kids coming in and they look like death warmed over. I mean, they look bad. And the parents will be like, he threw up twice. And, we threw up just a couple of times. And we don't know what's going on. And he's like, right? And we give them a bolus of fluids, or we give them some Zofran and give them oral solution, because that's the best. The best way is always oral. And then all of a sudden they're like perked up. They're throwing up still, but they're perky. All right? It's not the vomiting or the virus that really affects them. It's the dehydration. Children and infants. Remember, what is way larger in infants? The body surface area, right? So we lose about 2/3 of our insensible water loss through our skin and about 1/3 through respiratory, okay? So if I have a larger body surface area, I'm going to lose more fluids. So I'm more at risk for like when I'm overheated or I have a high respiratory rate of having insensible water loss. I also said that their metabolic rate was what? Higher, right? So when we have a higher metabolic rate, we have a higher water demand. Because if we're metabolizing things and our kidneys are filtering, we got to get rid of them, right? So we need more fluids to do that. Kids have immature kidneys, and they have little reserves. What you're going to see with kids is that they are chilling, and then they crump, like right in front of you, very fast. So they can compensate, but only for a short time, and when they crash hard. It's not like adults where we just kind of don't feel good, and then we finally seek help. Kids, when they get sick fast and hard. Oh, those are all those things I talked about. So high body surface area, a higher metabolic rate. They have a higher respiratory rate. So they, like we said, if you're losing water through your respiratory rate and they have a higher one, their kidneys aren't as developed, they have more fluid requirements, and they have little reserve. Yeah. Yes. And if I ever go too fast, let me know. I'm a fast talker. And sometimes when I get excited, I get really fast. So just tell me to slow down. Psychological things. Anxiety can affect threats to fluid balance. What does anxiety do sometimes to our respiratory rate? Increases it. What does it do to our heart rate? Increases it, right? So we need more fluids to keep it going. It also can affect, how much we're drinking or eating. When we get sad or depressed, what happens? Yeah, we tend not to eat or drink very well, right? We don't take care of ourselves. So there's definitely psychological things. And then there's also sociocultural. So there's like pica. You know, guys, what pica is? Where they eat just weird things. Yeah. Mm-hmm.
Cornstarch.
Those are wonderful examples. Thank you.
Sorry.
No, that's perfect. I hate when I lecture and you all just stare at me. It's awkward, so I appreciate. All right. So let's think about it. So what happens when a child or a small infant is febrile or they're placed in a radiant warmer? What's going to happen to their needs? Increase, right? And so are we going to ask you what happens when a child is placed in a warmer? They're going to have increased needs of what? Are we going to ask that? No. They're going to give you a clinical situation and they're going to say, you have a 2-month-old infant who was recently diagnosed with jaundice, who has been doing the Billy Lights, who's been in the hospital for the last day. You note that their heart rate is 180 and that their urine output is, 0.5 cc's an hour, whatever, less, okay? These are your nursing interventions. A, call the doctor. B, turn the Billy Lights off. 3, or C, give more fluids. D, do you see what I'm saying? That is where you have to take your thinking now. Because you know that 180 is a little tachycardic for an infant. And that, no, I can't remove them from the Billy Lights because they still need it for the jaundice. And I know that they're tachycardic, their urine output is down, and they're under lights, so they probably just need more fluids. And that's what I need to do. All right? That's where you guys have to take your thinking now. Because your patients aren't going to come in and say, hey, this is what's going on. They want you to figure it out. All right. So, what are some risk factors? Lots. I wouldn't worry about all these risk factors, y'all. You can write them down if you'd like. They're in your PowerPoint. But we've already kind of talked about them all on the previous page, okay? So, if they're febrile, if they have a respiratory infection, if they have vomiting and diarrhea, if they have burns, we're going to talk about that in test 2. If they have blood loss, if they have decreased intake, if they have adrenal disease. All the things we've already talked about, right? Those are all risk factors. What's more important, it's important for us to get a good history because a history is going to help guide our treatment. But we've talked about these risk factors. You've gotten a good history. Now you need a good assessment. Okay? So you get that history to try to figure out what is causing their dehydration. Do they have any current health problems? Do they have some kind of adrenal tumor that we're aware of? And we need to know their I's and O's. How much are they taking in? How much have they peed? And that's hard with kids because kids wear diapers. So parents are like, I don't know, they peed, But parents also are really astute. Like, I normally go through 6 diapers a day. They've only had 2 diapers a day. So document that. You may not always get CCs, but you'll get some kind of quantification. And the big thing is exposure to any recent infections. Basically, has anybody else been sick? Especially if it's a vomiting or a diarrhea. Does anybody else in the family have it? And how did it evolve? Like, did they start off with just a tummy ache, and then they started with diarrhea and then vomiting? Or did they just wake up in the middle of the night and vomit? One time we were out to dinner, my husband and I, and my kids were at home with my dad, who lives with us, but he's 75, and he's not great. Helpful, super helpful. But the kids are older. They're 13, 11. This was probably when they were 12 and 10. And my daughter FaceTimes me and says, from my dad's phone, and says, John just threw up. Do you want to see it? And showed me his pile of throw up to everybody at the dinner table. And then I was like, okay, what happened during the day? Did he complain of a bellyache before he threw up? Did he get does he have a fever right now? Does he have any rashes? What else is going on? No, Grandpa had given him 2 milkshakes and he just got full and threw them up. So that was what his. But you ask those kind of questions. All right. Physical exam is also super important. What is their general condition? Those who like to color code things, sorry, this is the first lecture I'm doing with you, so just let you know. I will always do clinical manifestations in green. I will always do diagnostics in purple. I will always do interventions in blue. You do not have to do it that way. It is a memory trick, okay? It is meant to make you remember things. When your brain can categorize. Mm-hmm.
Oh, yeah, that's
Yeah.
what I was gonna say.
Yeah, you can do whatever colors you want too. But if you are doing colors, stick to the same ones. Because your brain categorizes things, and it's a memory trick so that you'll be like, oh, you'll ask the question, you'll be like, oh, I know that was in blue. And then your mind will start going to everything in blue to kind of pull that information out, all right? That is kind of why I use this program, and I do all these different things. I've read a bunch of studies about ways people learn and how to learn best, and this was one of them, okay? Clinical manifestations green. Diagnostics blue. I'm sorry, diagnostics purple. Interventions blue. Etiology will always be pink. So if that's why you see the different colors, that's why. Okay? So general condition, basically, what do they look like? Are they ill appearing? But mental status. Mental status is a lot of times one of the first things we note with dehydration, especially with kids and the elderly. Kids get irritable. All right? Elderly get confused. So a lot of people don't associate, mood with dehydration, but it is one of the first signs that you will see with when they're starting to get dehydrated. When they're mildly dehydrated, they just don't feel good and they don't know how to quite describe it, so they just get irritable. If it is really bad, they could have decreased loss of consciousness. So MS is their mental state. Vital signs. We want to know temperature because we want to know if this is a febrile illness. Obviously the pulse, right? Because we need to know, if they're tachycardic, it helps us. Respiratory rate will be up, typically. And blood pressure. Now, a blood pressure in kids is not so important, okay? Because what do I say what happens to kids? They kind of just hang out and then drop. So their blood pressure is not going to change really when they're dehydrated until they're really dehydrated, all right? Adults, blood pressure is super important, okay? Adults' blood pressure will change very early in dehydration. So you want to make sure with an adult you get a good blood pressure prior because you're going to see changes. But with a kid, it's not as important.
So what would you say would be the first sign? Would it be the mental status?
Yeah. Mm-hmm. So for kids, after mental status, the most important thing that we can get is weight. That's going to be their biggest difference. Now, when an infant comes in sick, it's easy to see their weight loss. And that is how we measure their extent of dehydration, is by their weight loss. And like I said, infants, I told you, they come in like 11 times in the first 2 years or whatever. So we know a pretty accurate weight because we're weighing them all the time. It gets harder to do it when they're older, like I have no idea what my 11-year-old or 13-year-old weighs. I'm guessing in like the 95-pound range. Not sure. So it's much harder when they get older, but for younger kids, it definitely works, and it is the most accurate, especially in infants. So adults were watching that blood pressure, kids were watching that weight. Cap refill is a late sign. All right. Because that means you have really poor perfusion. So obviously it's a delayed capillary refill. I press your finger, it's greater than 3 seconds. But again, that's a super late sign. For kids, we can look at their tears though. And also, remember I said about their fontanelle, right? So with kids, you'll see kids who are super dehydrated, they cry, but no tears come out. It's like the most pathetic little thing ever. Because they feel miserable and they're crying and then just nothing is coming out. Their eyes can look almost sunken. Their fontanelle is sunken. And you'll see it like that. Normally, when the soft spot, you can't really tell there's a soft spot there unless it's bulging or sunken. And then you're like, why is there a divot in that kid's head? And that's because they're really dehydrated. You're going to look at their mucous membranes. Obviously, they're going to be dry. And then skin. How elastic is it? Skin is really hard, though, because think about it. Any of you got grandma at home, like 85, and you pull on her skin? It just stays there for like 10 minutes, right? And then slowly goes down. All right. That doesn't mean she's necessarily dehydrated. She's just got, not elastic skin. Yeah, doesn't bounce back. So skin is really hard. The best place for kids, where did I say is? Their belly, right? So grab their belly. You can do skin turgor there. All right. So we can look at I's and O's. And I's and O's are important. We want to know how much they're taking in. We want to know urine output. But you have to be careful because when we calculate I's and O's, we are not accounting for insensible water loss. And when I have a fever and my skin is hot and I'm an infant with a really large body surface area, my insensible water loss goes up. When I have a high respiratory rate, my water loss goes up. But when I put in a urine output, I'm not calculating those insensible losses. So sometimes you can be like, well, the kid drank, 10 cc's and he peed 10 cc's. We're pretty good. But if we're not taking into account that kid's under a warmer or that kid has been under a warmer, we think they're doing okay by their I's and O's, but they're not. And so it appears, so you have to be very careful because again, they're going to compensate, and then that poor baby. All right, diagnostics. We can get a CBC. With your CBC, we're looking at the crit, the hematocrit. So what is hematocrit? Anybody remember? What is it? The number of red blood cells in volume. So I love it. Like when I used to do clinicals, I'd love it. I'd be like, what are you guys looking for? And you'd be like, CBC, BMP. And I'm like, but why? And you're like, I don't know. I just know I get those labs. Okay. I love when you can scream out labs. It sounds very like Grey's Anatomy or like The Resident-ish, okay? But you have to know why you're getting those things. So when we get a hematocrit or a CBC, we're looking at that crit. Because think about it. If this is my number of red blood cells and this is my volume of blood, they should be equal, right? If my volume of blood goes down because I'm dehydrated, does my number of red blood cells really increase? No, they stayed the same. But hematocrit is the number of blood cells in relation to my volume. So I've got red blood cells and volume. My volume decreases. My crit's going to appear high. Okay? Yeah, high, dry. Yeah. So I know I need to give fluids, all right? There are times your crit's elevated because your crit is elevated, the red blood cells, but this is not the case, all right? And NCLEX wants to know that you understand that we're not going to be doing anything to the red blood cells because it's not the red blood cell issue, it is a volume issue, all right? UA, it's going to be super concentrated, right? Serum electrolytes, they have high sodium levels. So, and we're going to talk about this more. So, we've got, cells, okay? And sodium, normally our kidneys would excrete sodium, right? But we're not having a lot of urine output because we're dehydrated. So our sodium is increasing. What's following sodium? Water. So we've got water in these cells coming out. Okay? So our cells are now shrinking. This really increases your seizure risk. We can check stool because if we think that it's some kind of infectious process, we can check it. Although it's not really done a whole lot. It's not as important. BUN and creatinine are going to be up, right? Because the kidneys are affected. Again, poor fluid intake means poor cardiac output. Poor cardiac output means kidneys aren't getting perfused. If my kidneys aren't getting perfused, they're going to show signs and symptoms because their labs are going to be off. So the BUN and creatinine are off, elevated. Serum osmo is going to be super concentrated because you're going to be dehydrated. So how do we measure the extent of dehydration? It is done by weight. So it is the percent lost measured in weight. And you do have to know how to do this. So it is the original weight minus the current rate divided by the original weight.
Wait.
It's right there. Original weight minus current weight divided by the original weight. So let's say I knew that the baby was 12 kilos. Okay? So they're 12 kilos, and now they're 11 kilos. I'm going to divide that by 12. Right? Original minus what the weight is now divided by 12. And that gives you 0.08. All right? And we're looking for percentage, right? So what do we do when we want a percentage? Times by 100. So how many decimals do I move it? All right. I know that sounds silly, and I know some of you are like, why are you asking me that? A lot of you screw that up on tests, okay? You'll give me 0.8%, or you'll give me 80%. So you're doing the math right, you just don't know those small little things, and those add up to big points for you, okay? So move it, it's 8% loss. Oh, there's the, right there. So if it is less than 5%, it is a mild dehydration. If it is 5 to 10%, it is a moderate dehydration. If it is severe, it is greater than 10%. So where does this kid fall? Moderate. Okay. Mild dehydration is hard to detect. Again, they just might be a little irritable. Their heart may just be slightly elevated. When it's moderate, we start seeing more signs and symptoms. So all the things that we talked about, the dry mucous membranes, the no tears. Oh, do you have a question?
I do.
I wasn't sure if
It
you were
might be a
playing with
silly
your bow.
question. No.
Okay.
I was
Uh-huh.
not trying to interrupt you, but, so I have a question.
Uh-huh.
When it comes to measuring the water loss, fluid
Mm-hmm.
loss, what age group are you doing this for? From infancy to adolescence, or?
No, this is
more?
the younger age group.
Okay.
Infants, toddlers, maybe even into preschoolers.
Okay.
Yeah. Like I said, it gets really hard with the school age children because you don't know their weight as well. But still, the weight is going to be the most significant thing with younger children regarding their weight loss, or regarding their state of dehydration. Adults, we don't do this as much because we don't know. I mean, our weight fluctuates just if a woman has their period, if they ate salty food. Kids, their weight doesn't fluctuate like that. So, when it gets to severe, they're very symptomatic. The reason we worry really a lot about dehydration, especially in kids, is because dehydration can lead to shock, and shock leads to death. Okay. You're going to learn more about shocks when you get to level 4, so I'm not going to go too much into it. But basically, in shock, your organs aren't being perfused, and when your organs aren't perfused, they shut down. They start dying. So what do? We find the cause, first of all. Yeah. Because that's the other thing. That's a good, thank you for saying. A lot of people want to do something first, okay? And we do want to do something, especially if it's an emergency. But a lot of times what NCLEX wants to know is that if even I could keep rehydrating, right? But if I keep rehydrating and they're bleeding to death, have I fixed the problem? No. So a lot of times what NCLEX wants you to know is the first thing you got to do is figure out what's going on. Because you can't really fix it until you fix the problem. So you might have to rehydrate while you're fixing the problem, but you got to be fixing the problem while you're rehydrating. Does that
So at the same time.
Yeah. Because if you're just rehydrating and never fixing the problem, you're eventually going to not be able to keep up. Okay? So they always went some of the classic things like your order, ADPI, assess, diagnose, follow that. A lot of times NCLEX, that's why I say the more questions you do, the better you'll be at them. Questions will tell you where in the nursing process you are. They will say, you have assessed, what is your next step? So, and they won't say you have assessed, but they will give you an assessment, and they want you to know that the next step is, okay, you know how to diagnose. Or they will give you an assessment and a diagnosis, and they know, or they want to know that the next step is an intervention or whatever, okay? So pay attention to that when you're doing questions. Where am I in this nursing process? Because they always want you to start with assessment and work your way down. They want you to get a history, get an assessment, see what's going on before you start treatment. So find that cause, monitor those vital signs, super important. You're going to withhold diet until well hydrated. That is not fluids, that's diet. Okay? And a lot of people are then like, oh, we start with a brat diet or whatever. That's really gone out the window. You just advance to regular. If the kid is like, I want a cheeseburger, shove that cheeseburger in your face, dude. That's fine. If you're ready for it, go for it. Okay? But they're talking about diet in general. They're not talking about fluid. So until they're feeling better or until they're well hydrated, we withhold their diet. And then they can just advance to regular. Bless you. We always want to start with ORT, oral rehydration therapy. Always. Especially if they are mildly or moderately dehydrated. It is the best way for fluids to be absorbed. I work in the ER at All Children's. I can tell you 9 times out of 10, I'm popping a Zofran and some Pedialyte in that kid's mouth, okay? We rarely put an IV in to rehydrate. That kid has got to come in sick for me to put an IV in, okay? Uh-huh. Yep. Yeah. It's like once a month now, but yeah. I've been there for 15 years, so bless you. They kind of let me work my own schedule, which is nice. Yeah. No, it's just because why put them through that trauma of an IV when we can accomplish what we need to accomplish if we just settle their tummy and get them oral? And like I said, most of the time they don't feel good because of the dehydration. It's not because of the virus itself. So if I can treat the symptoms of the virus, which is the vomiting, and get them rehydrated, they do great. And a lot of times they'll drink and they still vomit, and they drink and drink some more and still vomit, and that's okay too, as long as they're, exactly, yeah. And that is why we'll hold the diet for a bit, because we don't want them vomiting diet. But once they're well hydrated, then we can start the diet and just advance as time tolerated. But they absorb better and they get the right kind of electrolytes and stuff if they can do it orally. Yeah. So Zofran, so the typical protocol in an ER, and this is just a typical protocol. So they'll give Zofran. They can do an injection, but again, we try to avoid that. It's a tablet that dissolves on their tongue, and we put that in there. It dissolves, even if they're like parched, dry. It will dissolve. We typically wait about 15, 20 minutes, and then we start with clears, and we do like 5 cc's every 5 minutes. We're going to talk about it a little bit, rotavirus. My daughter got a horrible case of rotavirus. That is like the most nastiest GI bug in the world, and it smells god-awful, and everybody got it. You have diarrhea, and you can have vomiting. It's significant diarrhea. And I can remember holding my daughter, and then I had it, and I was puking over the toilet as she was puking, like on the floor, and then just like, and her diaper fell off, and then poo was falling down, and like poo is all over me, and I'm vomiting. Like, if that, for those who don't have children, if that is not child
That is
protection,
totally
yeah,
birth control right
birth
there.
control, yes, that's the word I'm looking for. Yeah, and she was super, super dehydrated. So I was breastfeeding at the time, so I pumped milk, and what I would do is I filled a little dropper, and I'm like myself. But every 5 minutes, she would just suckle on this little like dropper, 5 cc's, and it just rehydrates them slowly. So if you can get them to do that, that is honestly the best way. Yeah. My husband got it as well. He disappeared for like 3 days, but and he was like, I remember him coming down. He's like, "Whoa, that was a bad virus, wasn't it?" And I was like,
We did.
I was like, I literally just got pooed on, but. If it is really severe, we will do IV fluids. Obviously, we're not going to be like, okay, try one more time to drink if they're just, if we've given them Zofran and they've waited 15 minutes and they just, and sometimes we'll wait 15 minutes, we'll give them some fluids and they throw up a little bit, and then we wait a little bit for their tummy to settle and we give it again and they do fine. That's okay. But if we give it to them and they throw up and we wait 15 minutes and they throw up again and again and again, obviously they're not keeping it down, then we will go ahead and start IV fluids. We also need to know if isolation is indicated. So if there's any possibility of it being infectious, they need to be isolated. Because like with rotavirus, that stuff spreads fast. All right, so why don't you want to give someone who is vomiting diarrhea something to drink with a large amount of sugar? Sugar. What about the sugar? The sugar is going to pull more water, right? So if I'm giving them, if they have diarrhea, right? And they're just, everything's coming out of them, okay? And I am giving them something sugary, like a Coke or a Gatorade or something really, really sugary. All that's going to happen is they're going to get sugar. More fluids are going to come out of the cell. They're going to lose more fluids and be more dehydrated, all right? So we will give them, we can give them something. Pedialyte is the best, right? Because it has all those electrolytes with water. And we're going to talk about why it's important to know water and electrolytes and all that. Pedialyte's best. If anyone's ever had Pedialyte, it tastes like butt. It's gross. You like it? Oh my God. It's awful. Yeah, I really, well, maybe I'm wrong. Maybe they have new and approved. Okay. But the Pedialyte that I know tastes like, the popsicles aren't so bad. The popsicles are okay, which is just frozen Pedialyte. But some kids really hate Pedialyte, and they will push it away. So we can do things like Gatorade, like halved with water, so that they don't get as much sugar, because we still want them to get some electrolytes, and so we'll half the Gatorade. But yeah, it's so funny because there's always like one person that really likes the Pedialyte, and everybody else who's had it is like, bleh.
Honestly, it's like, I never really believed it, so like, go out on Friday and on a Saturday morning, if you have Pedialyte, it actually kind of helps a lot.
So for other purposes. All right. What time is it? I wonder if I should give you a break before we get into this. Do you need a break? All right. Why don't we take a break?